Hi everybody, welcome again to Dr. Manny's YouTube Learnshops. This is part 1, which deals with nursing and health contributions and consider the process of reflexivity in qualitative research. And the learning objectives, essentially what we're going to cover are to look at you as a master's research student, your role as a researcher, and then relate the researcher's role to the nursing process. Review the timeline and highlight to you the importance of the nursing contributions both in a local and in a global setting. And highlight the importance of membership in certain organisations for you as a nursing researcher. And then to discuss the future contributions of qualitative research in nursing and health, and possibly why it's important to you and what you should consider as a researcher in the future. So let's rehash this. The aim of qualitative research is to understand the subjective reality of the study participants. And possibly after this session, or all the sessions that I've provided for you, you may consider the importance of qualitative research. And remember, this is not going to be achieved through superficial knowledge about large representative samples of individuals, as is done in quantitative research, but rather we, as qualitative researchers, want to reach people within the study who can share their unique experiences of their reality so that everything illustrates a wide range in that study area. So remember, the purpose of qualitative research is to describe. It's to understand. It's to explain. It's to develop and identify and generate knowledge. That's the purpose of qualitative research. So, let's look at the nurse's research role. As a Bachelor of Science nursing student, your degree focuses on critiquing and synthesizing research findings from the nursing profession and other disciplines for clinical practice. Evidence-based practice. And this provides valuable assistance to identify research problems that we've all identified in the clinical area and collecting data for these studies. What about your role? If you're a master's student, it's a little bit more involved. This is where you lead healthcare teams. It ensures that healthcare systems are based on evidence-based research. It's important to make essential changes to nursing practices, whether they're theoretical or clinical. And it provides you with opportunities to conduct investigations and collaborate with other researchers, which facilitates research, and you provide consultation. Then you've got the nurse researcher's role at doctoral level. And this assumes a major role in conducting research to generate nursing knowledge in a selected field of interest or domain. And this is supposed to extend nursing knowledge and to develop methods to evaluate and measure nursing phenomena. If you do have the opportunity to get to postdoctoral degree, this assumes a full researcher role, and it usually has an acquired fund, a funded program for research. And it develops and coordinates funded research in nursing. So what are important characteristics that you as a researcher should have? I believe that you should be passionate, with intellectual curiosity, be a creative thinker and a critical thinker, and utilise theories. However, you may develop your own conceptual theory about the topic that you're researching. It's important to remember to have patience and be disciplined, have integrity, and be honest. Intellectual honesty. And having said that, it can be a bit overwhelming at times, as you'll experience if you haven't already. So it's important to keep your sense of humour. It's not the end of the world if you don't achieve what you want to achieve immediately. And a good acronym is this researcher one that I found, according to Calmoran in 2004. The R says be research orientated. So follow the rules, follow the guidelines, be efficient, don't procrastinate, and don't make excuses. Be scientific and be effective and active. Be resourceful, creative, honest, and economical if you can be, and be reliable. These are all good researcher characteristics. Then look at the nursing process. It's really related to you as a researcher. The nursing process is essentially just a modified scientific method, and it was first described by Jean Orlando in 1958, and she described 4 stages to assess, diagnose, plan and implement, which could include evaluation. It's since expanded, since that 4-stage model, into a 7-stage model, which I'm not going to review. The nursing process, however, uses clinical judgment to strike a balance between epistemology, which is between personal interpretation, and research evidence, which is critical to your thinking and categorises the patient's issue and course of action, treatment plan. Look at the comparisons. So I put the comparisons here. So if you look at nursing research and compare it to the nursing process, the nursing research essentially is about problem identification. Something that you've identified. It conceptualizes the topic because you, as the researcher, are curious about the topic. And this may lead you to brainstorm with your peers in nursing or other medical disciplines, and it makes you review the literature to see what has already been done in relation to the topic that you are about to research. And you could, as I indicated previously, could develop a conceptual framework which states the problem that you've identified. If we compare it to the nursing process, problem identification, we look at the assessment phase. And this is where we collect data from various resources. And this uses appropriate techniques and methods and practices. Then you've got the nursing research methodology. This is where we identify variables or issues, and we may or may not formulate a hypothesis. This is where we determine our sample size and develop instruments or tools to help us get the information that we want. We also have to validate those instruments And this is done through employing rigour and trustworthiness, or other terminology which qualitative researchers use as well, which is reliability and validity. If we relate it to the nursing process, this is our diagnostic phase, where we validate and organise our data, we analyse and interpret healthcare issues, whether they're actual issues or potential issues that you've identified. And this is where we formulate a nursing diagnosis. Then we look at data management in the nursing research process. And this is where we collect and organise data, we analyse our data, we clarify and evaluate the findings and results. In the nursing process, this is our planning phase, where we prioritise health issues, identify care and resources available to us, set goals, develop a care plan. We select nursing actions and we evaluate the parameters, and then we revise if required or as required to do so. Then in the nursing research process, we disseminate our findings. We let people know what we've found. And this is where we publish our findings, we review our findings, and we critique them. In the nursing process, this is the implementation phase. This is where we implement a plan of care and we collaborate with our team members and discuss and modify our plan as required to do so, to ensure safe, effective patient care. If we look at our historical timelines, we as nursing researchers commenced in 1859. And this is when Nightingale published her notes on nursing. In the United States of America, who were very proactive when it came to nursing research, the American Journal of Nursing first published in the 1900s, or actually in 1900. In 1923, the first doctoral nursing program commenced at the Columbia University, and in 1936, Sigma Theta Tau awards the first nursing research grant. And we'll look at Sigma Theta Tau a little later on in this presentation and indicate why you should, as a nursing researcher, be a member. In 1948, the Brower Report came out, and this indicated the inadequacies of nursing education in the United States of America and globally. In 1952, the Journal of Nursing Research had its first publication. In 1955, the inception or the creation of the American Nurses Research Foundation occurred. In 1957, Walter Reed Nursing Institute was established. The evolution continues. In 1963, the International Journal of Nursing Studies published their first journal articles. In 1965, the American Nurses Association sponsors nursing research conferences so that nurses could go and publish as well as disseminate their research. In 1969, the Canadian Journal of Nursing Research had their first publication. In 1972, the American Nurses Association initiates what they called the Commission of Nurse Researchers, another organisation to promote nursing research. We move on. Nurses contribute considerably to nursing research. In 1976, the Journal of Advanced Nursing had its first publication. In 1977, the Journal of Research in Nursing and Health was initiated. In 1978, the Journal of Advanced Nursing Science was also initiated, as was in 1979 the Western Journal of Nursing Research. An organisation called the Conduct and Utilisation of Research in Nursing also became established. Nurses were very proactive as nursing professionals to ensure that their practices were evidence-based. In 1983, the Journal of Annual Review of Nursing Research had their first publication. The American Nursing Association, very active. Their research executives established what they considered to be priorities for nursing research. Then in 1988, Applied Nursing Research and Nursing Sciences published quarterly journals, which are still ongoing. In 1989, the United States Agency for Healthcare Policy and Research was initiated. In 1999, the National Institute of Nursing Research was established. Nurses are becoming more professional and realise the importance of evidence-based practice and professionalism, which encompasses publications for the profession. Then, in 1992, the Cochrane collaboration was established. We all know about the Cochrane Foundation, and if you don't, get onto the internet and have a look. In 1903, Magnet recognition awards were awarded to nursing researchers, and in 1994, the Journal of Qualitative Health Research is initiated. The first time we hear about qualitative research. In 2004, the World Views on Evidence-Based Nursing was initiated in their first publication. And the NINR issues a strategic plan for 2006 to 2010. This is the National Institute of Nursing Research in America. And I thought it was important to include Quorum. Quorum is the Qualitative Research Association of Malaysia. And they have a journal called the Malaysian Journal of Qualitative Research. And it published its first journal and articles in 2007. And look, it is important as nursing researchers to publish in your local journal. International journals are absolutely important, but from my perspective, it's also important to publish in your local journals. In 2010, the NINR had a budget in the United States of America of approximately 140 million. And that's important because it requires funds to publish. I thought it was important for this presentation to mention Sigma Theta Tau, which is an honour society of nursing. And it's an international organisation. And it has the objectives for advancing world health and celebrating nursing excellence in research, research scholarship, leadership and service. And Sigma Theta Tau's international vision is to be a global organisation of choice which is revered by nursing and the nursing profession. Some of the objectives of Sigma Theta Tau research, their priorities are: 1, to promote health of vulnerable and marginalised communities, which are in Malaysia as well as the global community. It's to promote patient safety and quality of healthcare, which is one of my passions, which I refer to as patient advocacy, because I don't think you can have patient safety without patient advocacy, which is a role that is very rarely mentioned in nursing. Then you've got the development of evidence-based practice and translational research, which should translate to all disciplines in healthcare. Research should be evidence-based, and if it's evidence-based, it can relate to practice, theory and practice. Then you've got the promotion of health and well-being of the ageing population globally, older people, which we're all becoming. It's a priority and has been a priority since 2004 for Sigma Theta Tau. Then you've got an emphasis on patient-centered care and care coordination. It should be patient-focused, and patients should be included in what care is being provided for them. Then you've got palliative and end-of-life care, which is another priority which Sigma Theta Tau recommends and endorses. Another research priority is in relation to genetic testing and therapeutics, which relate to the implications of care. Then you have one which is important for you, as they all are: the capacity development of you as a nursing researcher and as a nurse leader in the future. We need nurse researchers, especially qualitative nurse researchers, because qualitative research, as I've indicated many times previously, is about humanity. It's about human beings. It's not about numbers. It's about holistic care. And you as a qualitative nurse researcher or a quantitative nurse researcher, it's important for you to be involved. Sigma Theta Tau also focuses on working environments for nurses, because nurses, as demonstrated in the local and in the international situation related to the COVID-19 pandemic, can be put at risk as frontline healthcare providers. So research pertaining to these areas are vitally important in relation to things like burnout, recommended by Sigma Theta Tau. There's a focus on developing stronger evidence base through rigorous methods, increasing your trustworthiness of your data, especially in qualitative research, which is still reviewed skeptically by the scientific community. It's to expand local research in healthcare settings, so do the research in Malaysia, in Sarawak, in Kuching, and it's to increase multidisciplinary collaboration in nursing research. There's also a greater emphasis on systematic integration of reviews. So systematic reviews are important, but focus on the context of qualitative rather than solely quantitative. And it's to expand the dissemination of research findings. So whatever you find in your research, tell everybody. Present at international and local conferences. Publish locally and internationally. Don't forget the Malaysian journals. Whether it's the Malaysian Journal of Nursing or the Malaysian Qualitative Journal of Nursing. And this is to increase your visibility as researchers locally and globally. The highest priorities, which have already been alluded to, are to focus on patient-centered research, cultural issues for nurses and patients, healthcare inequalities and disparities. And again, remember your historical aspects which were related to nursing and where nursing has come from, as demonstrated in the timeline. Remember ethical decision making. Look, it's all very well to have theory and practice, but if you don't apply ethics to it, then there's an issue. Look at my research, Mortel. Just type in theory, practice, ethics, gap. Look at ethics in healthcare and clinical practices. Look at nursing education, especially in the pandemic and the benefits of online education and research. Look at nursing and professional regulation. Look at nursing workforce skill mix and healthcare management processes. These are priorities. So in summary, I think it's important to remember, previously uncommon in healthcare research, qualitative research is now and still receiving recognition and is utilised more often in healthcare research with social and cultural dimensions. Remember it. It's not all about quantitative and numbers. Qualitative research seeks to determine the meaning of phenomena through description and exploration. Qualitative research aims to develop concepts that aid in understanding the natural phenomena with an emphasis on meaning, experiences and views of your participants, whether they're patients or whether they're your colleagues. It also looks at the differences among qualitative researchers, and they do exist, especially in matters of ontology, epistemology, axiology, and the methodology, which are elements that you will have to review as you go through your career and journey as a researcher. Okay, thanks everybody. As previously, if you found this session worthwhile, check out some of the other Dr. Manny Learnshops on YouTube. Okay, bye for now.